Washington have voted to deregulate, deregulate, and deregulate and give tax credits to the wealthiest among us. What I want to do is to give tax credits to the middle class, to working people, help them get health care, support the public schools. That's the kind of change and reform that we need in Washington. And this baloney about some of us being a part of the problem, we're actually trying to help it by taking on those interests.
Thank you. I never thought I'd have to say this to an audience. Please behave. I hate to get to the extent where I would have to ask you to leave if you can't keep control of that. I would really hate to have to do that. I would be embarrassed, and I think you would be as well. All right, moving on to more important issues, or additional important issues. And Mr. Lynch, you will be the first one to respond to this issue. The number of Americans without health insurance continues to rise dramatically, jeopardizing the health of those people and burdening everyone else with the costs of health care for the uninsured. Do you believe reform of our health care system is necessary and doable? And if so, would you rather see a single-payer system or more consumer-driven health care?
Well, I'll tell you what. Again, we need to address the problem by figuring out what the problem is. We don't have a health care problem in this country. We have a health insurance problem in this country. And we have to address the problems as they really are. To say that we have 48 million Americans without health insurance is a lie. 10 million of those people are illegal immigrants and shouldn't be getting it anyway. Another 10 to 12 million of those people are people that can afford health insurance and choose not to do it. You've got another 10 million of the people that are very important, their children, and their parents can go and get them health insurance right away, but they have to go get it. If you want to know whether or not a single-payer plan or universal health care plan will work, look at the Department of Veterans Affairs. It's not working very well. And you know what? Right now, Medicare, one of the biggest frauds in our country, or biggest business is fraud. You can go out, and it'll cost about $3,000 to $5,000 for a drug, where you can go to Walmart right now, and you can buy that same drug for $4 a month. Right. Private versus universal. Universal will not work.
Thank you, Mr. Lynch. That's great.
When I was the chairman of the Healthcare Committee in the State House of Representatives, I passed some of the most far-reaching health legislation in the country, which Robert Wexler voted against, by the way. What I plan for my time in Congress is an expansion of Medicare to include people 55 and over, freeze the premiums of people 75 and over, eliminate the donut hole in pharmaceuticals, eliminate research and development costs from retail and wholesale costs to the public. That'll reduce your prescription drug by 30 to 35% alone. This plan of mine will include Medicaid buy-in for people 200% of poverty who cannot afford to buy health insurance, and they'll be able to buy in based on a sliding scale. It is a national health care plan that gets everybody involved and forces insurance companies to compete against that plan. It worked in Florida when I wrote it here. It did so well, the insurance companies fought to eliminate it, and they did in the year 2000 because it was working so well. And now we have a crisis where over 30% of our Floridians have no health insurance. I'm a doctor. I've done this before. I will bring national health insurance to everyone with quality health care. That's what I'll do in Congress.
Thank you. Congressman Wexler.
Thank you. I support a universal health care system, and I support a single-payer system. I was a big proponent of extending health care to about 6 million children. Unfortunately, the president vetoed that bill. The best thing we can do is allow the federal government to negotiate prices on behalf of America's seniors to bring down the cost of prescription drugs. We need a single-payer system so that the federal government will help bring down the cost of health care. We also need to provide tax credits to small businesses to allow them to better be able to afford health care coverage for their employees. On immigration, before we let immigrants into this country to work, we should ensure that their employers provide health insurance for them. That should be a condition of work so that they don't show up and cost the rest of the public. Universal health care is a right. It is not a luxury.
Thank you, Congressman. Mr. Lynch, you will have 30 seconds to respond.
Well, for the government to negotiate. They're not doing such a great job with it right now with that bailout package, are they? Well, you know, we've got a situation where, in Ben's plan, and I love Ben, but the bottom line is it's Americare, it's Medicare. Medicare costs us $432 billion a year, $60 billion of which is fraud. And Congress has approved $732 million to investigate the fraud. We're basically taking a car, saying that it's leaking oil, and instead of fixing the leak, we're putting more oil in it. And it's costing us money every time that we do.
Thank you. 30 seconds.
Medicare fraud is the highest committer of Medicare fraud in the insurance companies. They have 30% administrative costs. $2 trillion system, that's $750 billion in administration. When Medicare ended, it was only 3%. That's a 27% increase since they privatized Medicare. That's where a big part of the problem is. As far as illegal immigration, my opponent, Mr. Wexler, has no policy. He's for open amnesty for all illegal immigrants. I'm for a policy of individual screening of people who are here and shouldn't be here, and healthcare costs and other things that's costing us billions of dollars to take care of the illegal immigrants.
Thank you. Mr. Wexler, 30 seconds.
I would respectfully differ with my opponents, particularly as to the Veterans Department. Our veterans' health care, while it is not perfect, and nobody has fought harder to get better health care for our veterans, and now we have a new clinic opening up in Sunrise, thank goodness. But the Veterans Healthcare Department is an example of how we provide greater services to people in need at a more affordable cost. And we do it for veterans, and we should do it for each and every one of us as Americans, every child, man, and woman in this country.
Thank you, Mr. Wexler. Mr. Wexler, you'll be the first to respond to the next question. This question focuses on energy. What do you believe is the primary cause of global warming? And what would you do to ensure the U.S. does its part to work with the world community to reduce global warming?
It is one of the critical questions of our time. It's greenhouse gases, an increase in greenhouse gases. What we need to do is achieve energy independence for our country. We do it by investing $150 billion in alternative energy sources, solar power, wind power. We need to develop clean coal. FAU has got an extraordinary program off the Dania Pier for ocean current technology. Will not only help cure greenhouse gases and global warming, but this is how we put America back to work for the next generation. These are the kinds of innovative programs we need to do. And yes, we need to consider nuclear power as well. Countries in Europe get almost all of their electricity from responsible nuclear power. We cannot be dependent on nations in the Gulf for our energy forever. That is of great urgency. We need a Manhattan Project 2 in this country to develop alternative energy sources so we can defeat global warming.
Thank you, Mr. Wexler. Dr. Graber.
Yes, Mr. Wexler's recommendation was spent last week, close to $1 trillion to bail us out. So you can forget about that happening with this Congress. What we need, and I'm a scientist and I'll tell you right now, there's a number of things we have to do to clean up this planet. One, sure, we have to shut down the dirty pollution and everything we throw into the atmosphere and the drainage of our oceans. But what we need most of all is to replant trees, to protect our rainforests, to protect our algae, to get rid of the dead zones in the ocean. Because CO2 is converted to oxygen by those places, by those trees, by those algae. We are destroying them, we're destroying our oceans and our environment. That'll be the biggest way to do it. The energy crisis, of course, we have to go to clean energy, we have to convert our cars to something clean. We can do hydrogen. It gives off water. I mean, we could do that if we wanted to, but we have to push the technology and make it worthwhile for the companies to do it. It only takes an act of Congress to give incentives for the corporations of the world to do it. If Congress passes it, it'll happen. They are yet to do it because they're owned by the oil companies, they're owned by the Saudis.
Thank you.